Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, and I'm here to give you our update on the COVID-19 pandemic. So things continue to get better. Maryland now has a test positivity rate of about 7%. You'll remember about a month ago when that positivity rate was much, much higher. The Omicron variant has really gone through the community and infected many, many people who had low immunity against COVID-19. There are now 1,441 Marylanders in the hospital, either in a regular bed or in the intensive care unit, and that is much better than where we were a month ago when we were up over 3,500. At GBMC today, we have 27 patients in the hospital who are COVID positive, and that too is much better from where we were roughly a month ago. Of the 27 patients, 9 are in the intensive care unit. Of those 9, 3 have had some vaccination, and 1 has been boosted. You may have seen on the news this week that the CDC published a study showing that you are 23 times as likely to get sick and wind up sick enough to be in the hospital if you have not been vaccinated compared to someone who has been vaccinated and boosted. 23 times more likely. So the data internationally, nationally, and at GBMC are all consistent. Getting some vaccination gives you some protection. Being completely vaccinated at this moment, which means you've had your primary series and a booster, gives you very strong protection against being sick enough to be in the hospital or dying. Once again, it does not prevent you from getting infected. The vaccines were not designed to do that. It prevents serious illness. You may have heard that yesterday the governor stated that the state of emergency is ending, and he also stated that we need to begin to learn to live with the virus. What does that actually mean? We've discussed previously that there are many viruses that start in epidemic form where a lot of people get sick. There are many illnesses that start in epidemic form, and then we create vaccines against them such that many fewer people get sick from the virus when it comes to town. We will probably see that COVID-19 becomes like a cold virus, and we deal with it the way we deal with any other common cold. There will still be an occasional person with chronic disease or who is very elderly for whom this virus makes them very sick and perhaps takes their life, but that will become a relatively rare event. What we can't know is, will COVID-19 continue to change, and will there be new variants that pop up that make people very sick because they can evade the existing immunologic protection that people have gotten either because they've been vaccinated or because they got sick with one of the previous variants of the virus. And again, as we've discussed previously, the best way to protect against new variants is to get the whole world immunized. You may have also seen the New York Times and other media outlets have run reports showing that the United States of America is not as well vaccinated as many of the other industrialized countries, especially in Europe. Maryland, as a state, has over 70% of its citizens vaccinated, but that is not the case for a lot of the rest of the country. So we still have work to do across the world, but particularly in the United States of America. We're excited this week to hear that Pfizer has asked for emergency use authorization for their vaccine for children 6 months of age to 5 years of age. This is the largest population that is still at risk, and we need to get them vaccinated, even though it is not likely that if they were to be infected, they would get very sick. This is a group that can still transmit the virus to others. So we want to get them all vaccinated. So again, let me thank everyone in the community for your hard work to this point. Let me thank the healthcare workers. Let me go off on a tangent for a moment and say that the GBMC family stands in solidarity with the families of the 3 firefighters who lost their lives in Baltimore last week. Service to others, putting your life on the line for others, is such a gift for those of us in the community. We owe a huge debt of gratitude to those firefighters who lost their lives, and we stand united with their families. So again, please continue to wear your mask when indoors in particular, especially if you do not know the vaccination status of people who are with you. Please continue to advocate that everyone get vaccinated and boosted, and please wash your hands. Please keep social distance, again, when you are in groups where you do not know the vaccine status of others. We are here for you if you need us at GBMC. Be safe, and we'll talk to you again soon.